We've all been there, staring at a doctor's prescription like it holds the secrets of the universe. The scribbled lines and loops seem more like an abstract art piece than instructions for our health. It's a common joke, a stereotype even, that doctors have notoriously bad handwriting. But, behind the humor lies a serious issue with real-world consequences. Imagine yourself in the shoes of a pharmacist, struggling to decipher a doctor's handwriting while dispensing medication. Or picture a patient confused about their dosage instructions because they can't read the prescription. These scenarios, unfortunately, are not uncommon and highlight the potential dangers of illegible handwriting in healthcare. While we chuckle at the illegible scrawls, it's important to understand the reasons behind this phenomenon. The medical profession is demanding, often requiring doctors to make quick decisions under pressure. This fast-paced environment can lead to hurried writing, sacrificing legibility for speed. But hurried scribbles are only one piece of the puzzle. To truly understand why deciphering a doctor's handwriting can feel like cracking a secret code, we need to delve deeper into the world of medicine, exploring the factors that contribute to this enduring mystery. The life of a medical professional is a constant race against time. Doctors often face packed waiting rooms and a never-ending stream of patients seeking their expertise. Each patient encounter involves gathering information, conducting examinations, and formulating diagnoses, all within a limited time frame. This time pressure can significantly impact a doctor's handwriting. Imagine trying to jot down notes while simultaneously listening to a patient's concerns and analyzing their symptoms. The need to multitask and process information quickly can lead to hurried writing, where legibility takes a back seat to efficiency. Furthermore, medical documentation is extensive, requiring doctors to record detailed information about each patient's medical history, examination findings, and treatment plans. This constant documentation adds to the pressure, as doctors strive to maintain comprehensive records while managing their time effectively. The result is often a rushed script, filled with abbreviations and shorthand that only other medical professionals can decipher. While this may seem like a minor inconvenience, it has the potential to impact patient safety and the overall quality of care. Medicine, like any specialized field, has its own unique language, a complex web of medical terminology that can sound like a foreign tongue to the untrained ear. From anatomical terms like cardiomyopathy to medication names like acetaminophen, medical professionals use a specific vocabulary to communicate effectively with each other. This reliance on medical jargon also contributes to the challenge of deciphering doctors' handwriting. Imagine trying to write down a word like electrocardiogram quickly, multiple times a day. Over time, even the neatest handwriting can morph into a series of squiggles and abbreviations. Moreover, doctors often use shorthand and abbreviations to represent common medical terms or phrases. For instance, BP might stand for blood pressure, while HX could represent medical history. This shorthand allows for quicker note-taking but can make it even more difficult for others to understand. While medical jargon is essential for clear communication within the medical community, it can create a barrier for patients trying to understand their own health information. This highlights the need for doctors to bridge the communication gap using clear and concise language when interacting with patients. The journey to becoming a doctor is arduous, requiring years of rigorous study and practical training. Medical schools equip aspiring physicians with a vast amount of knowledge, from the intricacies of human anatomy to the complexities of diagnosing and treating diseases. However, amidst the demanding curriculum and intense focus on medical knowledge, handwriting often takes a back seat. While medical students learn to document patient information electronically, the importance of legible handwriting is not always emphasized. This lack of focus on handwriting skills can have lasting consequences. As medical students progress through their training, they may develop habits of hurried or careless writing, especially when faced with time constraints or stressful situations. While electronic medical records are becoming increasingly prevalent, handwriting remains a crucial skill for doctors. From jotting down notes during patient consultations to writing prescriptions, legible handwriting is essential for effective communication and patient safety. Section 5. The unspoken challenges, disabilities, and their impact. While we often focus on external factors like time pressure and medical jargon, it's important to acknowledge that some doctors may face individual challenges that affect their handwriting. Physical disabilities such as hand tremors or arthritis can make it difficult to write legibly, no matter how much effort is put in. Similarly, learning disabilities like dysgraphia can impact a person's ability to write clearly and coherently. Dysgraphia affects fine motor skills and can make it challenging to control the physical act of writing, leading to inconsistencies in letter formation and spacing. These challenges are often invisible, making it difficult for others to understand the struggles a doctor might face when trying to write legibly. It's crucial to approach this issue with empathy and understanding, recognizing that illegible handwriting is not always a sign of carelessness or lack of effort. Addressing these challenges requires a multifaceted approach, including providing appropriate accommodations and support for doctors with disabilities and fostering a culture of understanding within the medical community. Section 6. The Digital Prescription, a Modern Solution. In the digital age, technology offers a powerful tool to address the issue of illegible handwriting in healthcare. Electronic prescriptions, where prescriptions are digitally generated and transmitted to pharmacies, are becoming increasingly common, offering a more efficient and error-proof alternative to handwritten prescriptions. With electronic prescriptions, the risk of misinterpreting a doctor's handwriting is eliminated. The prescription information, including the medication name, dosage, and instructions, is clearly displayed in a standardized format, reducing the chance of errors during dispensing. Moreover, electronic prescriptions streamline the medication process for both patients and pharmacists. Patients no longer have to worry about losing their prescriptions or deciphering illegible handwriting. Pharmacists can easily access and dispense medications, improving efficiency and reducing wait times. The widespread adoption of electronic prescriptions represents a significant step towards enhancing patient safety and improving the overall efficiency of healthcare delivery. Section 7. Back to basics, emphasizing handwriting skills. While technology offers promising solutions, it's equally important to address the root of the problem: the lack of emphasis on handwriting skills in medical training. Medical schools and residency programs should prioritize handwriting as an essential skill, incorporating dedicated training sessions and assessments into their curriculum. These training sessions could focus on improving letter formation, spacing, and overall legibility. Students could practice writing common medical terms and prescriptions, receiving feedback from experienced physicians on their technique and clarity. Furthermore, incorporating handwriting assessments into medical training would emphasize the importance of this skill and ensure that graduating doctors possess the necessary handwriting proficiency to communicate effectively. By investing in handwriting training, the medical community can equip future generations of doctors with the skills they need to communicate clearly and minimize the risks associated with illegible handwriting. Beyond technological solutions and handwriting training, effective communication lies at the heart of addressing this issue. Doctors must prioritize clear communication with both patients and other healthcare providers, recognizing that legible handwriting is an essential component of this communication. When writing prescriptions, doctors should make a conscious effort to write legibly, using clear letter formation and avoiding unnecessary abbreviations or shorthand. They should also take the time to review their writing, ensuring that the information is accurate and easy to understand. Moreover, doctors should prioritize open and clear communication with their patients. This includes taking the time to explain diagnoses, treatment plans, and medication instructions in a way that patients can understand. By fostering a culture of clear communication and recognizing the importance of legible handwriting, the medical community can create a safer and more effective healthcare system. The consequences of illegible handwriting in healthcare extend far beyond minor inconveniences. They have the potential to impact patient safety and the overall quality of care. Misinterpreted prescriptions can lead to medication errors, resulting in patients receiving the wrong dosage or even the wrong medication altogether. These errors can have serious health consequences ranging from adverse drug reactions to treatment delays. In some cases, medication errors can even be fatal, highlighting the critical importance of clear and legible prescriptions. Furthermore, illegible handwriting can lead to miscommunication between healthcare providers, potentially delaying diagnoses or leading to inappropriate treatment decisions. This breakdown in communication can erode trust between patients and healthcare providers, impacting the patient experience and hindering effective care. Addressing the issue of illegible handwriting is not merely about aesthetic preferences or professional pride. It's about ensuring patient safety and promoting a culture of clear communication within healthcare. The issue of illegible handwriting in healthcare is complex, stemming from a combination of factors ranging from time constraints to systemic oversights. However, by acknowledging the problem and embracing a multifaceted approach, we can create a future where clear communication and patient safety are paramount. Adopting digital solutions, such as electronic prescriptions, offers a significant step towards eliminating the risks associated with illegible handwriting. These technologies streamline the medication process, reduce the potential for errors, and enhance communication between healthcare providers. Simultaneously, we must address the root of the problem by emphasizing handwriting skills in medical training. By incorporating dedicated training sessions and assessments into medical curricula, we can equip future generations of doctors with the skills they need to communicate clearly and effectively. Finally, fostering a culture of clear communication within healthcare is crucial. Doctors must prioritize legible handwriting, taking the time to ensure their prescriptions and notes are easy to understand. Open communication with patients, explaining medical information in a clear and concise manner, is equally vital. The enduring stereotype of the doctor's illegible handwriting, while often treated with humor, underscores a serious issue with potentially life-altering consequences. Beyond the rushed scribbles and cryptic abbreviations lies a confluence of factors, from the demanding pace of medical practice to the complexities of medical language, yet this is not an insurmountable challenge. By embracing technological solutions, prioritizing handwriting skills in medical training, and fostering a culture of clear communication, we can transform the landscape of healthcare. Legible handwriting is not merely a matter of aesthetics. It's a fundamental aspect of patient safety and effective healthcare delivery. Let us strive for a future where a doctor's prescription is not a cryptic puzzle but a clear roadmap to better health. Clear writing paves the way for clearer healthcare, ensuring that patients receive the right care at the right time without the risk of misinterpretation or error.